Welcome back for episode 2. Today we move from principles to practice. Now that we understand the basics of risk adjustment coding workflows, I'm going to walk you through concrete chart examples that show you the difference between good and bad coding. Let's start with a quick framing. For HCC capture, you must have clinical evidence in the chart and a clear, documentable diagnosis or treatment plan. If either is missing, you either miss the HCC or you write a compliant query. I'll show both approaches. In this first case, we see an example of a poorly coded diabetes chart. Patient has a history of diabetes and takes metformin intermittently. This is insufficient because a history of and intermittent medication don't show active treated disease or complications. This often maps to unspecified diabetes codes that might not meet HCC requirements. To improve this, consider type 2 diabetes mellitus with diabetic neuropathy. The patient complains of numbness in feet and is treated with duloxetine. The last A1C was 8.7%. The plan is to optimize glucose control. This is better because the provider documents the type, complication, neuropathy, and active management. This supports a specific ICD-10 for diabetes with neuropathy and the HCC mapping, leading to a higher RAF impact than unspecified diabetes. If documentation is lacking, use a compliant query. For example, ask, does the chart show metformin use and a prior diabetes entry? Confirm if the patient has active type 2 diabetes and any current diabetes-related complications. Keep it brief, refer to chart evidence, and avoid specific coding language. In case 2, there is a chart that says patient experiences occasional shortness of breath and has a history of heart disease. This does not work because symptoms alone are insufficient. A provider must assess and label it as heart failure, noting the severity or treatment like diuretics or reduced ejection fraction. A clear note might say, systolic heart failure, chronic NYHA class 2. Echo 3 2024 EF 35%, on furosemide 20 mg daily and carvedilol. Continue current regimen, will monitor weight and BNP. Here, the diagnosis, objective test, and therapy all support coding chronic systolic heart failure linked to heart failure HCC. Coding tip, if EF is reduced and cardiology notes systolic or systolic dysfunction, choose the specific ICD-10 for systolic heart failure. Specificity aids HCC capture and eases audit defense. Case 3, COPD versus asthma. A poor note might say, wheezing with history of asthma and COPD. This is problematic due to potential miscoding. Encoders need a clear COPD diagnosis or testing. A proper note for diagnosing chronic obstructive pulmonary disease is COPD moderate with chronic oxygen need. Spirometry 2023 shows post-bronchodilator FEV1/FVC less than 70% consistent with COPD. Home oxygen is prescribed. So why is this one more effective? Because the spirometry testing and clear COPD diagnosis back the HCC. In this last example, we see a note that just says patient depressed. This is too vague. We need clear details on diagnosis, severity, treatment, and timing. In this example, you may query the provider, but remember to avoid suggesting a diagnosis. Instead of saying confirm major depressive disorder so we can code it, try the note states depressed. Please clarify the diagnosis, current severity, any active treatment, or recent PHQ-9 score. This approach is compliant and addresses key concerns. We want the note to state something like major depressive disorder, recurrent moderate. Started sertraline 100 mg on March 12, 2025. Psychotherapy biweekly. PHQ-9 score was 15. Follow-up in 2 weeks. That one line gives you everything you need: a specific ICD-10, severity, active treatment, an objective score, dates, and follow-up. Boost your HCC coding with these best practices. First, use your HCC checklist from episode 1 every time. Locate all relevant documents and ensure the diagnosis is clear. Choose the most specific ICD-10 as per the latest guidelines. Verify the condition is managed and check your HCC grouper for hierarchy or exclusion issues. If uncertain, ask the clinician. A quick query can prevent issues. Use tools and technology to promote templates or smart phrases for diagnosis, treatment, and follow-up. Highlighting gaps in the EMR helps providers identify gaps and enhance accuracy. Third, be aware of common pitfalls. Avoid using unspecified codes by default. They may not map to the best HCC. Keep the problem list updated. Add chronic conditions if they're missing, or send a query to correct it. Medication lists are useful, but need a provider's statement linking meds to diagnosis, or it's unclear. Finally, remember modifiers and laterality. For musculoskeletal and surgical codes, laterality and specificity matter. Always code to the highest level based on the chart. Small workflow and documentation changes can improve accuracy and revenue. If you want HCC templates or checklists, let me know in the comments and I'll share resources. Bonus tip, get comfortable with analytics. Learn Excel skills like pivot tables, VLOOKUPs, data visualization, and basic formulas to show ROI or find opportunities. This boosts your impact and credibility. Want to ace your HCC exam and get comfortable with coding? Here's a 90-day plan. In the first month, practice coding with real charts. Look for labs, meds, and provider statements to pick the right ICD-10 code. Ask, what proof do I need? And collect examples of charts showing ICD-10 and HCC mapping. Review about 20 charts daily to get familiar with coding guidelines. In the second month, use an encoder tool, write compliant queries weekly, make audit packets, and take a timed CRC practice test. In the third month, review more charts, join a risk adjustment community, attend a webinar, track your coding results, and create a quick reference tip sheet. Follow this plan, and you'll not only pass your exam, but also become a top HCC coder. Thanks for tuning in to our 2-part crash course on risk adjustment coding. We've covered everything from the basics and coder workflows to real-world examples and CRC exam prep tips. Subscribe to Wealthcare Inc. to keep learning about the business of healthcare and other key industry topics.